we're so happy to mark Rare Disease Day in Kenya. I feel like the whole rare disease community around the world is celebrating the adoption of a UN resolution on persons living with a rare disease and their families. What is a UN resolution?
Thank you, Shaulani, for the question, because a lot of people wonder what is a UN resolution. So it's definitely not binding on member states. That means that it's what we call soft law. Nevertheless, it signals a very strong commitment from member states. So it sends a political message to say that the countries that have adopted this resolution support the issue of rare diseases. And in our case, it's particularly strong because this resolution was adopted by consensus. This means that 193 UN member states consider the challenges of persons living with a rare disease and their families as a priority.
Great, thank you. And how has Rare Disorders Kenya advocated for this important milestone?
Yes, so the involvement of Rare Disorders Kenya was very important and was from the very beginning, because you might remember that at Rare Disease Day 2021, we launched a campaign for the adoption of the UN resolution, and we also launched a specific campaign called Dear UN. What it meant is that we asked to send testimonies about a life with a rare disease, so to send a direct message to the United Nations. And both Christine and Rosaline from Rare Disorder Kenya sent a duo testimony that was really underlining some of the key points that we wanted to raise and to make the UN aware. So it was really spot on. They spoke about their lives as mothers with a child with a rare disease. So it raised gender inequality issues, the impact on their professional life of being a caregiver. And this links with the Sustainable Development Goal related to access to decent work. And overall, their testimony underlined the fact that in addition to health-related issues, directly health-related issues, there are a whole range of other issues, which means that the challenges of living with the rare disease have to be addressed in a holistic way. So it was particularly important. I also know that Rare Disorders Kenya used the toolkit that RDI has developed also to reach out to national authorities at country level. So yes, very, very important support of the campaign.
Great. And what are the key topics covered by this resolution?
Yes, so as civil society organizations, we proposed to the United Nations to cover specific topics that you can indeed find in the final text of the resolution. So very importantly, we started with a whole range of issues related to human rights. So this means that the first topic is human rights, inclusion, full participation in society, fight against discrimination, stigma, marginalization, which is something that persons living with a rare disease and their families experience everywhere in the world. The second key theme is around appropriate care. And very importantly, it touches upon universal health coverage for rare diseases and generally speaking, access to diagnosis, treatment, health and social care, etc. The third key theme is about national measures. So there is a specific call in the UN resolution directly to national authorities and governments to adopt specific measures, specific plans, strategies to address the challenges of persons living with the rare disease at country level. And the last topic is more inclusion of rare diseases within the UN system. So really an improved recognition of the existence of rare diseases, of the visibility of rare diseases in more agencies and programs of the UN system.
You mentioned the country level. What could this really mean for families and persons living with a rare disease in Kenya?
So first of all, and this is obviously true everywhere in every country, so for every country level, as you say, this UN resolution means that we have made an invisible population visible. Now there is a UN resolution specifically dedicated to this very vulnerable population. This also means that the challenges of persons living with a rare disease and their families are now recognized as being specific to this population. This means that it's not the challenges of other bigger populations. It's specific to this population, which is a huge step forward in the work of awareness around rare diseases. It also means that progressively we can move towards, we can improve progress towards social justice and equity for persons living with a rare disease. This is the value of the UN resolution per se. The mere existence of this resolution gives more recognition, more visibility, and moves towards health equity. Now, the UN resolution will also be very useful as a door opener towards other opportunities. So as we were mentioning before, also through the testimony sent by Rare Disorders Kenya, rare diseases need to be addressed holistically. But now what we want to do next is also to deepen the issue related directly to health. So what we hope to do now is to start to campaign. We are going to target a WHO resolution. And for that, the key topic will be ensuring universal health coverage for rare diseases. And we know, for instance, that Kenya has been very supportive of UHC. Kenya is a friend of UHC in UN language. And so we hope to count on the support of Kenya and other countries for the campaign and for the adoption of a WHO resolution. Also, we want to go beyond only health issues because the UN resolution has now opened the door towards other UN agencies. So we can work now more with the Office of the High Commissioner for Human Rights when it comes to human rights. We can work more with UNICEF for children, education. We can work more with UNDP, with World Bank. So it's really, it opens us a lot of possibilities in other domains with other UN bodies. Very importantly, the UN resolution provides this global legitimacy. It provides the global framework to empower groups such as rare disorder rare disorders, Kenya, to empower them and strengthen them to drive change at national and local level. So there is really this synergy between this international, this global framework that will empower and give more legitimacy to national groups to work with national authorities towards a better life for persons living with a rare disease and their families. Thank you.
Great. Thank you, Femania.
I'm still joined by Dr. Elizabeth Onyango, who is a public health specialist and the head division of NCD Prevention and Control at the Ministry of Health. The cost of enabling all these strides that you're making on behalf of those living with rare diseases and their caregivers. The question is, with this UN resolution, is there something we can plug on to, perhaps, that can enable your ministry to move forward?
For every group, you know, when the UN recognizes a condition, then that becomes a good resource mobilization tool. It sets motions globally because of the commitments. Then the member states are able also to support that commitment. And also as a country, we have through our permanent principal secretary currently, we have, she wrote a support letter towards that, and that now sets the agenda to resource mobilize, because for any of those commitments to be actualized, you need various forms of resources to like strengthen the system so that it is responsive and in line with the resolution. Because I believe that in the next UNGA meeting, or regional even meetings, there'll be progress, and we will be asked, how far have you gone into implementing and actualizing the provisions of the resolution? So for us, that actually sets motion for the department and the ministry to take it seriously and put in place mechanisms yeah, so that we align.
Okay, now some of the statistics I had mentioned earlier actually highlights the fact that rare diseases impact more people than cancer and HIV and AIDS combined. What does that mean to you, and perhaps how should that set the precedence for prioritization of the RD space?
Currently, as a country, we don't have data to that effect. And we, as I said, we are just trying to put systems in place, and part of the focus will be to come up with a registry so that we are able to collect data that can guide now our decision making. So we don't have data for Kenya. What we might just rely on are statistics from outside, but I know the burden in terms of cost, in terms of the suffering and the hardships that those who have the disease and the caregivers and their families and even the country and the communities go through is huge. It's only that we have not quantified it. Yes, so that will be an opportunity for us as we come up with action priorities, interventions, and then put in place a registry. Then with the data that we shall collect, we will now confidently say this is what we have for Kenya, and how does it compare with the cost of HIV, cancer, which are also quite huge.
And speaking about how big or momentous some of these burdens are, we are still in a pandemic, but the world over has learned a lesson or two in terms of what can be done or put in place to enable some of these things we're talking about today. So what are these lessons perhaps you're walking into this space with from the pandemic?
COVID-19 hit the world like two years ago, and we can see it affected every sector of the society, and globally I think there was a shutdown. But one thing that we learned within that short time, organizations, governments were able to mobilize resources and the number of resources that were mobilized were huge. The number of researches that were done, number of the policies that were put in place and practices within a very short time. And we've had many these other conditions over this time, but we have not seen the kind of attention the COVID received. We've not seen in this other condition, but I believe that is one way we can leverage on. Yeah, we've really learned that if there's commitment, political commitment from governments, from private, everybody else, then we can be able to tackle some of these challenges that faces. And even the media forgot about almost all these other conditions, focused on COVID-19. So there's goodwill, but we just need to really support. COVID is still with us, we can say, but we have, from it, we have learned how to manage it, we hope that very soon it will be controlled, but there's a number of things that we have learned.
Okay, and even as we bring this conversation to a close, Dr. Onyango, I mean, having to head this division that caters for the non-communicable diseases, what can Kenyans in the RD space expect from the Ministry of Health going forward?
Well, rare disorders, these are like any other conditions. They're not conditions that can be sorted out by one sector. We shall still enhance and foster multi-sectoral collaboration, working with the various organizations, patient-led groups, civil society. We shall work with the media. We shall work with just other sectors, so that we prioritize the rare disorders. We don't want to leave anyone behind. And in the spirit of the UN resolution, reach the farthest faster, so that every child, every person in this country, every woman will be able to access the kind of care that they deserve. Healthcare, comprehensive healthcare, and just not healthcare, but quality healthcare that will be able to address their needs, and they should not suffer financial hardship in doing that. So for us as a ministry, we are going to put in place policies and strategies that will enhance and address the needs of the persons living with rare disorders.
Okay, now that is Dr. Elizabeth Onyango, Public Health Specialist and the Head Division of NCD Prevention and Control, Ministry of Health. She will be joining us in a moment later on, even as we consolidate this conversation. But at this point, she was talking about heavily on the just passed resolution by the UN that actually recognized the rare disorders community around the world, and that puts their agenda firmly in the UN's agenda. That goes a long way to ensure that their rights are always taken care of, and also given priority by their host countries, as Dr. Onyango talked about. And something else she touched on is the importance of research. This is so vital, and that's why we need to have a conversation about it, perhaps understand what we're doing as a country and as a continent to enable the same.